Tom and I are senior citizens on Medicare, and the deductibles, if you go for an MRI, and I had to because I hurt my arm real bad, it cost me $200. Now, I hurt the other arm, and I said to Tom, I can't go for another MRI. I can't afford $200.
My wife and I retired from one of Pinellas County's largest and oldest companies with a combined service of 53 years. And we learned 2 weeks ago that we will lose our earned retiree health care benefits.
How did they tell you? How did it? What?
We learned about it on Facebook.
Yes. My daughter gave her kidney, one of her kidneys, to my daughter-in-law, and the insurance company dropped her. Her husband and 2 sons have insurance, but they dropped her.
Can I say, they're greedy bastards. That's what they are. Seriously. And how much money can you spend in a lifetime? How much money do they need on the backs of the elderlies and the poor working people and the young people?
Why do you think it was important to bring him out here?
Because we're doing it for him. You know, they want to make sure that they have a future, a good future. They want health care for them.
I have a grandson who has autism, and it costs a fortune even with health care because so many of their treatments are not covered by health insurance. So if my son, God forbid, if he loses his health care, my grandson will never be able to get insured because he's got a pre-existing condition. My son will wind up as one of those bankrupt people, a kid who has worked since he was 14, not a bum, worked hard all of his life. So that's my story.
Yes, we will. I cannot afford insurance for myself or my wife, who's a teacher. Our children are insured under Florida Kid Care, which is part of the S-CHIP program, and we thank God every day that they have that insurance, and it's very good insurance. And I don't see why we can't either extend something like that or something like Medicare for middle-class people our ages.
We need change. We do. You know, the wealthy people have insurance. Senior citizens have Medicare, and the poor have Medicaid. It's the middle class, really, that's getting screwed.
I'm lucky. I'm a veteran. I've got health care, right? I'm retired. I have health care. But I've seen so many people, 30s, 40s, 50s, who don't go to doctors because they can't afford it. They put off taking their kids, which need to really see doctors. But I was a volunteer firefighter EMT for 24 years. I've seen what happens. What happens is EMS gets a phone call, somebody's half dead because they haven't been receiving something as simple as a pill that would have prevented the whole incident.
I think it's terrible. I think that this is a very important issue and that people should be working together, both sides of the aisle, to really lay out a good and sensible plan and get everybody involved in getting the kind of medical help that we all deserve.
We need something serious in the way of health care. We seriously need it. And if we don't get it now, like during the civil rights, if not now, then when? And that's it.